Hi everyone, Dr. Remy from Pain Free and Fit and Posture. Today we've got a great exercise for those of you with degenerative disc disease in the lower back, known as the dive bomber. Hope you enjoy. So one of the basic tenets of lower back rehabilitation for not only degenerative discs, but herniated and bulging discs, is that most disc problems are aggravated of all the motions that the spine can do with flexion or bending forward. That compresses the front part of the disc. It pushes the inside of the disc material, the nucleus, backwards, many times aggravating herniations, bulges, and degenerative disc pain. So one of the things that therapists and doctors in terms of rehab always working on with patients is to try to create an extension or arch in the lower back to prevent that flexion or that collapsing of the arch forward. They use various muscle techniques, various exercises to do this, but one of the great exercises that we can learn to do is called the dive bomber. It's an upper body exercise. It's a variant of the push-up, and it can be used to help with degenerative, herniated, and bulging disc pain. To begin, make sure that you understand what your pain-free range of motion is. By tucking your tailbone under and pubic bone up, you'll be flattening the arch in the lower back. Go as far as you can until you feel a little bit of a pull or stretch in the lower back. That would be your limit of flexion with the pelvis going that way. And then go the opposite way, lowering your pubic bone, raising your tailbone, and increasing the arch in your back. At a certain point, you may feel a little tension, a little irritation in your back. That's another point or end of your range. So you're going to stay within this range of how much tail up feels comfortable and how much tail under feels comfortable as you do this dive bomber. Because we have degenerative and disc problems such as herniations and bulges, we're going to be emphasizing the extension or tail up part as well as bending the thorax backwards to increase that curve. Remember though, it has to be within a range that's comfortable. If it's causing pain, no good. You want to back off of that. Keep in mind also any other muscular or joint or body position postural corrections. If you're not sure what your unique posture or body mechanics are as it relates to your pain in your lower back, go to either the Pain Free and Fit and Posture website. We have a free body analysis. Check out where your stability muscles, such as your transverse abdominis, your internal and external obliques, your multifidus muscles, see where they're not working right, learn how to coordinate their control patterns of your spine. Learn to know if you have a tendency to hike one hip up or lean to one side, to twist your pelvis to one side. You want to make sure you're globally setting your rib cage, your pelvis, and your spine in a good position for this or any exercise so you don't irritate it. Otherwise, exercises like this or any other exercise that we do here on the program is going to more likely irritate your lower back rather than help. So we'll start on our hands and knees and just review after we've checked what that tail up and tail under motion is that feels pain-free. I want to work with that. I'm going to engage my core muscles, my lower abdomen, correct any musculoskeletal weaknesses or inhibitions of stabilizing muscles. I'm going to connect those muscles consciously. I'm going to contract them. I'm going to connect my brain to my muscle. I'm going to set my pelvis and my rib cage in a way that creates a nice level and neutral posture. And then I'm going to brace slightly my abdomen like somebody's going to punch me in the stomach. That sets my lower back into a nice stable, what's called neutral spine position that's unique for me. I'm going to get up into a pike position where my hips are higher than my shoulders. And as I maintain those core contractions, I'm going to descend at an angle, moving downhill with my chest until I get to the point of about a normal push-up position. At this point, here's where the lower back's going to start arching. I'm going to come uphill, making sure I don't overarch the back, but staying within my particular pain limits of my ability to arch my lower back. Once I get to the end of that uphill, I'm going to move back down again, following the same arc, and then push uphill. This is targeting, besides spinal stability, my pectoral muscles at different angles. As I come down to the first half, it's like an incline chest press, then it turns into a flat chest press, and then it turns into a decline chest press or dip. So I'm hitting all aspects of my pecs and upper body, as well as my arms, triceps, shoulders, and especially increasing that practice or that coordination of the stability in my lower back. Again, as I come down, arching as much as you can from this point up is going to be helpful for the disc. As we put that extension of that arch into the lower back, it helps to gently push the fluid or the nucleus of the disc forwards from the back position because we're extending, we're compressing the back of the spine. It's helping to push that fluid forwards, and that's going to many times help relieve disc pains. If you like this video on Divebombers and degenerative disc disease, please feel free to subscribe to our channel. Got a lot of great videos out there. If you're looking for a great exercise program that'll help you figure out where your muscle stability issues are, how to help your own degenerative disc problems, how to put together a self-rehabilitation technique to not only help get you out of pain, stimulate healing, but also get you back into activities and sports and working out without hurting yourself, check out our Fast Track program for degenerative disc disease, available at the painfreeandfit.com website. I hope this video on Divebombers and degenerative disc disease, herniated and bulging discs, helps you with your chronic low back pain and fitness.